Severe Flat Foot, Surgical Repair of Flat Foot by Dr. Peter J. Bregman. This is a recent flat foot transformation where we can compare the operated side to the non-operated side. It was a 2.5-hour outpatient procedure with very little pain, and he and his parents are so excited and pleased with the outcome. The left is the operated side, and we are now going on to the next, which is the right side. Here we're going to watch the patient in slow motion. You can really appreciate on the right side how flat the foot is and how hyperpronated it is. As he comes walking towards us, you can note all sorts of changes between the 2 feet and the differences. The left foot is stable while the right foot is collapsing down. And we can really see that as he turns around here. And if you look at that heel, it kind of just everts out of the way while the left foot is still pointing outward a little bit. But as he continues to improve and we get the other side done, that's all going to straighten out. Again, in slow motion, you can really see that collapse of the talus and the ankle turning inward. And here I'm going to have the patient turn and just show us from a static viewpoint what it looks like to have a flat foot. And you can even see the toes are starting to straighten out. And right here is sort of the money shot here. You can see that ankle collapsing inward on the right, the heel pointing outward, the too many toes sign. And here we're just going to show from the side view what that looks like. And this is the corrected foot. You can actually see a little bit of an arch there. And he's not making that. That's just a byproduct of the surgery. And we're going to show the other side in a second just to show you that remarkable transformation and difference that occurred. On the right side, there's no arch at all. It's just flat and bulging out. And this is something that's going to get fixed. So that's great. Here we are looking at weight-bearing x-rays both preoperatively and postoperatively from this procedure. On the top, we see the AP or DP views. The green line, that is the bisector of the talus, is pointing towards the outer right portion or away from the first metatarsal, which is abnormal. We want to have that line, as you see on the left, parallel or even with the first metatarsal, which shows a great correction. The red line is the cuboid abduction angle, which shows the abduction or too many toes sign when you're looking at it clinically. That should be less than 10 degrees. It started off about 30 degrees and now it's about 7 or 8 degrees once it's been corrected. On the bottom we see the lateral views where the yellow line is the talar bisector, which normally be parallel to the magenta line, the first ray. On the left, the preoperative side, it's not, and on the right it is. The blue line is the calcaneal inclination angle, which on the left is 0 degrees, and on the right it's now about 15 degrees. So overall, excellent correction with the following procedures: gastrocnemius recession, calcaneal slide osteotomy, subtalar arthroeresis procedure, and cotton osteotomy of the medial cuneiform. Really a big, great transformation of a flat foot. And the patient did great, and we're getting ready to do the other side.